Hello everyone. Today, we're exploring the medication Ventolin. As always, this discussion is for educational purposes. If you have health-related questions or concerns, it's essential to consult a medical professional. Description: Ventolin, also known as Ventolin HFA, is primarily indicated for the treatment or prevention of bronchospasm in adults and pediatric patients aged 4 years and older with reversible obstructive airway disease. Additionally, it is used for the prevention of exercise-induced bronchospasm in the same age group. Dosage: for bronchospasm, both adult and pediatric patients aged 4 years and older should take 2 inhalations by oral inhalation every 4 to 6 hours. However, in some patients, 1 inhalation every 4 hours may suffice. For the prevention of exercise-induced bronchospasm, the recommended dosage is 2 inhalations by oral inhalation 15 to 30 minutes before exercise. It's crucial to note that Ventolin HFA should be administered via the orally inhaled route only. Priming Ventolin HFA is essential to ensure appropriate content in each actuation. It's recommended to prime the inhaler before its first use, if it hasn't been used for more than 2 weeks, or if it has been dropped. Regular cleaning of the actuator with warm water is also advised to ensure proper dosing. Warnings: Ventolin can produce paradoxical bronchospasm, which may be life-threatening. If this occurs, it should be discontinued immediately, and an alternative therapy should be considered. Asthma may deteriorate acutely or chronically, and if a patient requires more doses of Ventolin HFA than usual, it may indicate asthma destabilization, necessitating a re-evaluation of the patient and treatment regimen. There are also cardiovascular effects to be aware of, such as changes in pulse rate or blood pressure. Overuse of inhaled sympathomimetic drugs can be fatal, and hypersensitivity reactions, including anaphylaxis, may occur after Ventolin HFA administration. Side effects: some potential side effects include paradoxical bronchospasm, cardiovascular effects, and hypersensitivity reactions, including anaphylaxis. Other side effects observed in clinical trials include throat irritation, upper respiratory inflammation, viral respiratory infections, cough, and musculoskeletal pain. Post-marketing experiences have identified additional adverse reactions, including hoarseness, arrhythmias, and hypokalemia. Interactions: concurrent use of other short-acting sympathomimetic aerosol bronchodilators with albuterol is not recommended. If additional adrenergic drugs are administered, they should be used with caution. Beta blockers may produce severe bronchospasm in asthma patients, so they should be used with caution. Non-potassium-sparing diuretics can worsen the ECG changes or hypokalemia that may result from albuterol. It's also essential to monitor serum digoxin levels in patients receiving digoxin and albuterol. Ventolin HFA should be administered with extreme caution to patients being treated with monoamine oxidase inhibitors or tricyclic antidepressants. Use in specific populations: pregnant women should be closely monitored, and medication adjusted as necessary to maintain optimal asthma control. Ventolin HFA should be used with caution during labor. There is a pregnancy exposure registry that monitors pregnancy outcomes in women exposed to asthma medications during pregnancy. The safety and efficacy of Ventolin HFA in children between birth and 4 years of age have not been established. Closing: that concludes our overview of Ventolin. Remember, this information is for educational purposes and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for joining us.